This is chapter 2, the pharmacy technician. So the following are the learning objectives. At the completion of this particular chapter, you should be able to be familiar with the overall aspects of the pharmacy technician job and the general role of the pharmacy technician in relationship to the pharmacist. Know what personal standards are expected of a pharmacy technician. Understand the overall scope of HIPAA regulations concerning interactions between healthcare providers and patients, as well as regarding the patient's health information. Understand the range of training and programs and what agency established training and certification regulations and what organization accredits training programs. Know what technicians must do in order to receive certification and how often it must be renewed. So these are the key points that you should look forward to understanding by the end of this chapter. So think it through. City worked in a community pharmacy as a technician and want to gain the CPHT credential, that is a certification of pharmacy technician credential. And so as you read this particular chapter, you should be able to understand the following questions, or consider the following questions. How Stacy can achieve her certification as a pharmacy technician, and then looking at the differences and similarities between the two key exams, which is the PTCE and the CPT. And then how would Stacy, in this particular scenario that we're talking about, maintain her certification as a pharmacy technician? These are the key points that you should be familiar with. So what are the chapter outlines? Well, this particular chapter look at the pharmacy technician, the personal standards, training and competency, and certification process, and the maintenance of the certification. And so, and then of course we will look at a question or two at the end of this particular chapter. All right. So here we're talking about the scope of practice. When we talk about the scope of practice, we're talking about the boundaries of one's job at the place of employment, what they can and cannot do, what is designated for that particular employment activity, and here we talk about in relationship to the pharmacy technician. There's specific responsibilities and tasks different by settings. We're going to talk about the different settings in which pharmacy technicians can find themselves. The two that predominate is a pharmacy technician working at the community pharmacy and also working at a hospital pharmacy. Those are the two major places of employment for a pharmacy technician. But there are other places where you may find a pharmacy technician. You may find them working within a compounding pharmacy. You may find them working within a managed care setting, long-term care setting, a hospice setting. You may find them in working at a home health setting. So there's different settings that they're talking about. And so there are slight differences between what a pharmacy technician may do within a compounding pharmacy in comparison to what they may do within a community pharmacy. But the overall job description would be the same. And then as we go forward, we'll look at the different policies and procedure manuals associated with being a pharmacy technician and their scope of practice. Okay, I want you to take the opportunity to look at these particular videos, and they give a very good overview about the pharmacy technician, and also the other video deals with the exam. And we're going to talk about the certifying exam, what you need to know in that regards. This is a very important. Some background information that you should be familiar with in relationship to the pharmacy technician is that in healthcare, technicians are individuals who are given a basic level of training designed to help them perform a specific task. This is a little bit different than the professionals. Professionals consist of the physicians, the pharmacists, and they receive a little bit more extensive and advanced level of education than the pharmacy technician. In addition, the pharmacy technician, in order to perform their duties, pharmacists rely upon the assistance of trained support staff, and these staff is called a pharmacy technician. The pharmacy technician performs such tasks as filling prescriptions, packaging doses, performing inventory control, and keeping records. And we're going to go into a little bit more details of what that entails. Like pharmacists, most pharmacy technicians are employed in community pharmacies and hospitals. And we talked about the different settings. And the primary settings that you will find pharmacy technicians, again, is that of the community pharmacy and that of the hospital. So what are the different type of responsibilities? And these responsibilities come under the physicians, the pharmacy technician, rather, scope of practice. And when we talk about the scope of practice, this is what individuals may or may not do in their jobs. Again, this is considered the scope of practice. And so what are some of the things that a pharmacy technician do? Well, they take patient information, whether verbally or via a prescription. They're involved in filling the prescriptions that have been sent to them from the physician. Some of them, especially in compounding pharmacies, may do some compounding, which means mixing of different type of chemicals to produce a particular drug. And again, if you look at the link that was sent to you on the in this particular lecture segment, there is a video showing a young woman actually engaging in compounding a process. This is very important, working with a team of healthcare professionals. The pharmacy technician is part of a larger team. The pharmacy technician, of course, the pharmacist, in which they are under, and the pharmacist supervises the pharmacy technician. And outside the pharmacy, there are maybe with team, the other team members will be the physicians and nurses, as other health professionals. They will be involved in ordering. This is very important in terms of maintaining the inventory of drugs that needs to be filled and other items as necessary within the pharmacy. Inventory control. At times they may be sent to look through the different shelves of medication in order to determine what is missing, what they have, what has gone out, what has remained. Of course, using computers, we talked about that in chapter 1, something that is very, very important. And then we have also talked about receiving prescriptions that can be filled. So these are the responsibilities, and these responsibilities fall under the scope of practice. One thing that should be noted that the pharmacy technician do not have the right to or the permission to do any type of consulting. That type of consulting is reserved for the pharmacist. Okay, so again, as a recap, the pharmacy technician in healthcare, the technician are individuals who are given a specific basic level of training, which are and they're designed to help perform specific tasks. To perform their duties, pharmacists today rely upon the assistance of trained support staff called pharmacy technicians. Pharmacy technicians perform such tasks as filling prescription, packing doses, performing inventory control, and keeping records. Like pharmacists, most pharmacy technicians are employed in community pharmacies and hospitals. This is something that is very, very important, and I would like for you to really have a great understanding of what they are talking about. So when we talk about the personal standards, these are the standards that are associated with the duties and the scope of practice and the responsibilities of the pharmacy technician. This is very important that the pharmacy technician is able to take a personal inventory of themselves in order that they can perform at the highest level possible within this particular scope of practice associated with the pharmacy technician. The pharmacy technician is a member of the team, and that is the patient's healthcare team. Again, consisting of the physician, possibly the nurses, and the pharmacist, and of course the pharmacy technician, as we are talking about here. One thing that's very important is the respect for patients. The number one thing and the most important consideration in healthcare is the patient's welfare. To ensure this, there have been various government laws and professional standards to guarantee the basic patient rights and require healthcare providers to explain these rights to the patient. This is something that's very important. In page 26 of the book, there is a great need for confidentiality. And we're going to talk about in details what law cover that particular requirement. And again, making and having a personal inventory. And we're going to touch base on that in a few moments. So what is a personal inventory? Well, these are qualities that a pharmacy technician should have, must have in order to perform their scope of practice properly. They must be dependable. That means coming to work on time, not leaving any work behind that they need to do and doing their work honestly. They must be detail oriented. Any mistake can lead to challenges among the patients. They must be trustworthy. You cannot take away out medicines outside of the designated area within the pharmacy. You will be entrusted with confidential patient information, dangerous substances, and perishable product. In addition, many of the drugs are very expensive, and you will be trusted to handle them appropriately. Health. You must maintain very good health and mental health, both physical health and mental health. This is very important because, again, there is a accuracy that is necessary for you to do this job well. Hygiene, bathing on a daily basis, wearing and using deodorant. These may seem like trivial things, but it's very important that as you interact with patients, that you look good, smell good, you wear your uniform well, you are well groomed, and whatever the standard is in terms of interpersonal interactions, wearing, that you maintain those particular standards. Again, practice good hygiene. You will interact closely with others. Poor hygiene will hurt your ability to be effective. You will be also expected to perform in infection-free conditions, and poor hygiene is a violation of this requirement. Appearance, making sure you're looking good, having good mathematical and problem-solving skills, knowing your terminology and language is something that's very important. Having very good computer skills, and we've been talking about this over and over again, and it has been reiterated in chapter 1. And then interpersonal skills. You must be able to interact well and be personable individuals to your team and to the patient.